Long short-sightedness and to see things blurry are due to a light not focusing properly on the retina. Surgeon can correct this by a laser to reshape the curvature shape of the eye. The surgeon operates only one eye at a time. He cleans the eye with antiseptic and anesthetic drop to freeze the eye and lid. He opens the lid wide with spectrum and wrenches the eye with saline solution. Everything frozen so the patient doesn't feel any pain. Next, an antibiotic drop which prevents infection. Before every operation, the surgeon tests the equipment. He tests the laser on metal plate to test inches level in different parts so they can prevent from faults on any machine. The surgeon added more some antiseptic drops. Then inspect the microkeraton, the device used to lift the very thin layer from the outer side of eye. The patient's conea is measured by using an ultrasonic instrument. The surgeon used spectrum again to open the lid, then began the operation. The eye is marked with equipment to reference mark be used to be later. Next, a metal ring is positioned around the cornea. The ring is fixed to the eye. It is steady while slicing. It holds the eye while surgeon cuts the tissue. The surgeon lubricates with the extra water around the eye. It absorbs extra water with small absorbing sponge. The microkeratin is slapped into the groove with metal suspension ring. In the microsecond, the device moves across the eye, cutting over a tissue. The surgeon uses the sponge to prevent contaminating the cornea. They fold back the tissue to cornea. They observe all the liquid and finally start the laser machine. Meanwhile, the sponge keeps the flip moisturized. The laser and, and an unusual light fires 50 pulses per second. Each pulse vaporizes one coat of microcorneal tissue. The laser is controlled by computer program so it knows exactly shape the cornea to give patients 20/20 vision. In less than a minute, laser has done his job. Then, surgeon clean the eye and remove the sponge and folds back the flap to its original position. Then surgeon clean eye and remove sponge carefully. Within 45 seconds, negative pressure inside the cornea suck the flap back. The flap literally seal itself. Antibiotic is required to preventing measure and then use machine to verify everything okay. He take spectrum back and take the eye closed and perform same on the other eye. Finally, patient wear protective case. Thank you.